Might. Oh, there we go. Okay. Sorry about that.
That's okay.
Okay, so for this interview, quite a few questions. Wanted to start with just some background information. I know you've been on the BBC, you have been exploding the internet, but for people watching this that might have missed some of that, what was your story? I know you've been ill for decades, and
yes, that's right. Yeah, the I had problems with my knees when I was really young, and my father used to try and pull them out because they were not kneed. And at 17, my one of my knees started dislocating. And then at 23, I got a virus, a gastro virus, and I never really recovered after that. So I had, typically the extreme fatigue, post-exertional malaise,
yes,
and just generally felt unwell, to be honest.
yes. So you basically had a post-viral onset, or what appeared to be a post-viral onset. Similarly,
That's
yeah, to Jen Brea and myself, and ultimately CCI enabled us to overcome what had started seemingly with a virus. Okay, so that happened to you in your 20s, early 20s,
that's
and
right. I was 23 when that happened,
yes,
and then various things happened in between that and being age 36 when I was actually diagnosed with the
with
ME.
ME, with ME.
Yeah, I was diagnosed with ME at 36 after 13 years of being unwell. I'd had a TIA in that time. I'd gone temporarily blind. I'd snapped my plantaris muscle in my leg. There were so many signs that something was very wrong. But nothing got picked up again because obviously, I had ME and that was the end of the story. And then eventually, pure it was a fortuitous mistake on the behalf of the consultant that he sent me to a musculoskeletal unit. And from there, I ended up eventually with a diagnosis of Ehlers-Danlos loss, hypermobility, a genetic alteration too, to the TNXB mutation, which is for classical-like EDS. But my ME diagnosis still stands on my GP records because it was after an illness that I didn't recover.
Yes. So essentially, do you consider yourself to have had ME? There's somewhat of a debate within the community, within the ME community, I should say, where if somebody with a history of ME, such as yourself or me or Jen Brea, even if it's post-viral or post-infectious, if we recover from CCI surgery, some people would say that we never had ME to begin with because they conceive of ME as a diagnosis of exclusion. So once you find the underlying cause and fix it, then people might say you never had ME to begin with. I can tell you briefly my take on that, and I would love to hear yours. Um, if ME is a diagnosis of exclusion, then by definition, as science progresses, ME will cease to exist, right? Nobody will ever have had ME because we are finding their underlying cause. Therefore, get out of the ME community. It was a misdiagnosis all along, no matter how well it fit, no matter if it was post-viral, post-exertional malaise, never happened. What would be your take on this?
Well, I don't agree with that. I think post-exertional malaise it may well have existed alongside craniocervical instability, or maybe that's a causal link between the two. There's certainly a huge overlap, for example, between all the symptoms of ME and Ehlers-Danlos. So, you could even go as far as to say, well, how do we know that ME isn't another variant of EDS when we've got 14
Absolutely.
subtypes already.
Yes, I agree with that position, and I think quite a few others do. On the other hand, there's some threat. The IME community, what has your experience been when presenting this? Do you find that people feel quite threatened? I have seen that. Curious as to what you've seen.
Yeah, there's certainly been a huge amount of debate in the last week that I've come across. Yeah, absolutely. I can understand why people might be dubious of the difficulty I'm having is that a lot of people are saying, oh well, everybody's going to go and try and rush off and have craniocervical fusions, and they may not need them, and I agree with that. But that's very easily rectifiable, because if somebody has neurological symptoms, there is nothing to stop them getting an upright MRI. And that's as far as you need to go. And if you haven't got anything wrong in your neck, end of story.
And the assumption that you could immediately get a fusion, you're just going to rush off and put yourself on that table. It doesn't exactly happen that way. The neurosurgeons are going to want to do extensive testing.
Absolutely.
Yeah, so there's definitely some fear.
Doctors would definitely want to do a lot of testing. They won't just operate willy-nilly, as a matter of course. They have to know something's wrong. But the upright MRI scan in the first instance will give a good clue. And if there is something showing, then at that point you then go and see a neurologist, and they do their bit before deciding whether you can have a cervical fusion and it'll be of benefit to you. I understand there is also a part of me that agrees with you that there is an element that people are coming across as feeling a bit threatened by this. I don't quite understand why, but I do agree with the wording of that.
Okay.
They're defensive.
I sense that as well. I've also had people that have heard of your story very recently because it just exploded, and they have contacted me. Prior to your story coming out, people would contact me and say, I've been ill with ME for decades. Is there any hope? And now your story is out. So this is a way of showing people that this can happen.
Absolutely, because believe me, now I'm nearly 52, only having been diagnosed last year with the issue. Yeah, you're not kidding. Age 23 to age 52. That's a lot of years. So yeah, absolutely.
Yeah. Yeah. So what would you say the contrast is between your life for those nearly 30 years and the life that you have now? Is there any way you would like to?
Yeah, I didn't have really. I'm so stubborn, and I had, worked 3 days a week up until 2016. But on the 4 days that I was in bed, and in the end I had to leave work. It was not practical. I didn't know whether I was going to be on crutches one day or not, or what might happen. And actually, I think I had just about got to my tether. I was like, oh, this is not a life at all.
Right. Yes. Oh, I'm sorry. Just one moment. I'm so sorry. I'm going to need to pause it here. I will be right back.
Okay.
Okay. So you said it was no life, essentially. And now, where were we?
Now everything has changed. I've only just had the operation, so I'm still a little bit tired, of course. But I'm not spending 16 to 18 hours in bed every day anymore. I'm spending most of my day up. I'm just going to bed early.
Yeah,
and that's about it. really, to be honest. Yeah, that's it. So other issues that I had, head pain, at the side of my head, at the very base of my skull, neck pain. I couldn't control my heart rate,
That was
temperature, or blood.
before surgery. That is, that was.
Yeah, that's exactly it. All of those things, as I say, apart from still being a little bit tired, all of those things, I'm symptom free. I'm not even having to wear things like my leg braces that I used to have to wear to keep my knees.
Yeah.
Yeah. So it's even affected as far down as that, which is amazing, because obviously I had my treatment in Spain with Dr. Gillette, and he told me he had no idea what would happen to my lower half. He couldn't guarantee what would happen. He only knew, that this side, of me, this upper half, all those sorts of symptoms, hearing and eyesight cutting in and out, suddenly becoming hypersensitive to sound or light.
So he's surprised in some way
certain that those could be
much things have improved for you.
Yeah, well, I'm hoping really that there are a few of us now that are sort of having this, and I appreciate that some symptoms was that?
Are you still there?
Can you hear me?
I can hear you.
Yeah, I was just saying, can you hear me?
Oh, we cut out for a moment there. Let's see. Okay. Can you hear me now?
Sorry, where were we?
Oh, you were talking about the various improvements you've had and how Dr.
Can
Gillette.
hear you, yes.
Yes. What made you consider CCI as a possibility after having ME for nearly 30 years?
Well, actually, it came about at the time of my Ehlers-Danlos diagnosis. I went there saying, look, I'm absolutely sure that I meet the criteria for Ehlers-Danlos. And it had been mentioned to me, how do you see this? Well, so I had to look it up, and I thought, actually, do you know what? A lot of this seems pretty accurate to me. So I went to see Dr. Hakim in London, and he's a EDS specialist over here, and he was looking at all my joints and saying, well, look, yeah, looking at my skin and saying, that's absolutely true, and you've got extra big hands, and a narrow palate, and all sorts of diagnostic criteria. But in the process, he asked me to put my head forward as far as I possibly could, and of course my neck touched my chest.
Okay.
And he said, now I want you to roll your head in a circle very slowly, but still keeping it as far over as you possibly can. And I kept where I was. He said, you juddered all the way through that. And he said, and you've got a problem with your neck. You'll need to have it checked out. So actually, I was very fortunate in that he mentioned it at the actual time of the EDS diagnosis. But knowing that there wasn't any treatment, or it was unlikely to get treatment in the UK, I have to say that, because they did actually do a few each year. But we don't know on what basis. I have written asking for that information. But knowing that they wouldn't consider it here, I then went ahead and ordered the Med-Serena upright scan, which obviously did point out some issues. And then having that in, I then Dropboxed it to Dr. Gillette saying, could you pass a comment? And he's asked me if I would pop over to Barcelona, which of course is easy from here, and have some cine radiology done as well. in order for him to be completely happy about diagnosing. But he also gave me a symptom list that I had to complete and score.
I see. So he had thorough list of your symptoms and also did an in-person evaluation. And as you said, you're very fortunate that I think his name was Dr. Hakim. He was a neurologist.
Yes, correct. Yes, Dr. Alan Hakim. Yeah.
That he was able to spot this. That's actually incredibly rare. Most of us, no matter the country we're in, I have actually never heard of what happened with you happening with somebody else, where the neurologist was literally able to spot this problem and then recommend. Was he able to recommend?
He's actually a rheumatologist.
I see.
Yeah, he's a rheumatologist, and he is one of the top doctors in the UK, as a specialist in Ehlers-Danlos. And so even if I hadn't had Ehlers-Danlos, he would have picked up on the fact that there was a problem with the neck, because it didn't operate, as it should. The thing is, of course, that people have to remember that if you're living with something for a very long time, and particularly with the neck, or being a bit bendy, you don't judge that as maybe being an issue. You just think, well, that's my normal. Most of your life, you won't even question it.
We don't even know how weird we are.
No, exactly. We don't know, and we have no means of knowing how somebody else is feeling. So, say for example, I felt I had low energy. I wouldn't actually know that without knowing how somebody next to me felt. So, a lot of the time we don't question things like that. We just assume, well, that's normal, or.
Yeah, especially in the early stages where we may not be extraordinarily disabled, where we're still trying to function within society, and we see our peers, our workers, our fellow students just, it's a very sort of, we're able to compare ourselves. Whereas, as the years go on, we sort of become more homebound. We don't have the comparison. So very interesting. What would you want to say to people who are very, very skeptical that CCI could fix ME, that it would be worth just being evaluated? If somebody gets evaluated,
I would say somebody has them. I mean, everybody's desperate not to have ME, right? I mean, I'm guessing the case. I mean, otherwise I won't understand. But so in the case of being desperate with ME, subject to being able to afford it, I personally would go and have the upright scan done. In the UK, that's at a place called MedSerena, and it's available in Knightsbridge, London, or Manchester. The cost, when I had it done, it was £1,250. Now, that's a lot of money. But if you put it into the comparison of your life continuing to decline when you're already desperate, you might just find that money. And then you'll either know one way or the other. You'll know you either, okay, you don't need surgery, so that's a relief. You haven't got to find more money, or you have got it, and then you've got an issue because you then actually have to fund the surgery, but you have a chance of a life. And I think most people, it seems to be, will take that chance. But without having this upright scan in the first place, it's not even worth people worrying about. They should only worry about it if they're going to have the scan done.
Yes,
otherwise,
I hear you. I think that, and I agree with your position. I would add that perhaps if somebody can afford to get a scan, but not the surgery, if perhaps they know they may never be able to afford the surgery, but they can afford the scan, that alone might give them peace of mind, or it might be very frustrating.
It might certainly give them ideas. I mean, I know I was given some, because you have to be then really careful with your neck. Obviously, if it comes back and you're not going to have surgery, or you can't afford surgery, you're going to have to be careful with your neck, and you're going to have to do some very, very careful head exercises. So I know for Dr. Gillette sends out a message that you should really only just put your hand against your head and give a little resistance, and then the sides. And that's basically all he suggests. Nothing else. Don't do anything else. And as to wearing a collar, it is best if you can to only wear it for 4 hours a day.
Yes.
The more you wear it, the more muscle wastage you're going to have at the same time. That's not helpful because you then got to build that up too.
Exactly.
So, yeah, that I think those would be my main points. I mean, I'd love to say that everybody with ME could have craniocervical fusions and would all be recovered. But I have to be realistic. We're not in a position to say that just yet.
No.
However, there are certainly a number of people for whom it is true and that have an ME diagnosis. I know of a couple of others. So it's interesting because there's maybe it's a subset, maybe it's just another symptom that, at the end of the day, even with ME, we all have slightly different symptoms.
Sure.
This could be just another one.
And we have no idea until more people become evaluated. We will never know. We will never know if this is, 20%, 10%, 80%. There is just no way of knowing until more people become evaluated. Another thing that you were saying about why it might behoove somebody to get an upright MRI is that dental appointments, if people are able to go to the dentist, you would want to support your neck. Car rides, perhaps, if you're a passenger in a car, you might want to guard your neck if you know that it is unstable. As you were saying, there are neck exercises that can help provide some stability to somebody. Our muscles can function as secondary stabilizers to the ligaments that might be lax. So
that's right.
And so it might behoove people to get evaluated should they want to. I know that sometimes new ideas can feel threatening, or they can, sometimes people have an identity built around ME being a viral problem or any other type of problem than mechanical.
Yeah. Well, it makes perfect sense. If you think about it, if your spinal cord is being impinged in any way because of cervical instability, then the nerves that are running from your brain down to your organ parts are all going to be affected.
Yes. So, and in your autonomic nervous system is very affected when your brainstem is being compressed or distorted.
Absolutely.
Forces.
Absolutely.
And your autonomic nervous system works in tandem with your immune system. So for example, I was ill with ME, fairly severe for 3 years, during which time I never mounted a cold. I never had a cold or a flu. I had a viral onset. My immune system would not fight off colds that other people would bring into the house. After I got my fusion, and then I had a tethered cord surgery, suddenly my immune system's working. I'm catching colds again. My thinking is that, and I've actually seen some scientific literature to support this idea, there's quite a bit out there, that our autonomic nervous system is integral to our immune system functioning. And without one, you don't have these other bodily processes, heart rate regulation, POTS, dysautonomia, immune dysfunction.
Yeah, absolutely. You're just listing everything I had. So
and it reads like a textbook of ME symptoms, and it's just such a fascinating new way of looking at something and a potential avenue for a lot of people to get help. It's just a matter of.
I think if people realize, or just think about the fact that, their brain has all these, all these transmitters coming to everybody part, maybe they'd understand why it could be the nerve that's affecting. It may just be that people don't appreciate that, and once you say it in those terms, it suddenly then becomes, actually, that could be a very real possibility.
Yes,
rather than, oh my goodness, I don't want to pay money for a scan unnecessarily if this is just a fad.
Like a neck
Um,
problem. I have, okay, so these people had neck problems. How could a neck problem with your bones give you ME? It sounds kind of like, no, that's just out there. But yes, it's the neural structures, the neurological structures that essentially govern everything in our bodies. You could see how that would cause multi-systemic dysfunction throughout
absolutely.
our
Yeah,
entire, um,
yeah.
yeah.
Makes you wonder how many other conditions actually, so the rarer conditions, are actually in the same situation. And again, it could be something similar where messages are getting through to certain body parts, and that could be completely different conditions.
Still need more examination, way
Uh,
more to figure all this out. Um,
yeah,
I would like to see people with ME. I would like to see their physicians rule out a craniocervical instability problem, early on in the process, the same way a physician would rule out a thyroid problem, the same way they would
absolutely.
rule out sleep apnea. They do a full workup. I would like to see it include, eventually, this is not going to happen right away, rule out the structural issues. I think that would potentially help a lot of people, and it would also help advance our understanding of how big the subset may be within the ME community.
I think it would save money too. It
Of
would save,
course.
certainly on the NHS, and quite probably with patients, going to and fro for a number of years, if certain things were just, could it be this, could it be that, could it be the other, go through the whole thing, um, pretty quickly, so that it's not dragging on for ages. And if that were the case, because we know that there are situations where if people get enough bed rest early on, after having a virus, saying having post-exertional malaise, if they have plenty of bed rest early on, they have a better chance of a recovery.
Right.
So that that alone should be made very clear. And if the doctors had the ability to do all these tests swiftly, um, they could, and at the same time, be telling these patients in this situation, you know what, you need to rest. I mean,
Yeah.
years ago, that used to be prescribed. You need plenty of rest and fresh air. That was a actually, the prognosis, not the prognosis of the doctor, but the doctor's
Doctor's orders. Bed.
orders. Yeah, doctor's
Yeah.
orders. That's it. Yeah, doctor's orders. Um, and it was all taken very seriously. We now live in a society where suddenly, that isn't taken seriously, and actually, it probably should be, because it does a lot of good.
Yeah.
Um,
Yes. And as far as a theory as to why that might happen, there's a theory that during a viral infection, the collagen can become weakened by just the inflammatory process of fighting off a virus, or maybe
yes,
something even specific to a virus or specific type of bacteria even, and that could compromise the ligaments. And if we're very active during the time where our ligaments are compromised, it could domino effect on the capacity of the ligaments to support our heads and our spine. So there's some speculation. At this point, it's just speculation, but there is some literature suggesting that some viral conditions or bacterial conditions can actually cause the ligaments to become compromised. And I'm just thinking back to what you're saying about how resting might actually help. Perhaps it would just prevent the damage coming during the
yeah.
time when they're vulnerable.
Well, it would certainly fit with the stats where
Yeah.
it's where in terms of the people that rested right at the beginning had a better recovery rate,
Yeah.
therefore resting helped. Was it, that it was just, I don't know, exhaustion, but or burnout, or was it because actually by resting their neck and head was in the correct position, uh,
Exactly.
to allow itself to heal, before it got past the point where it could. Uh,
Yes. So,
yeah.
there's a concept of parsimonious. Like, what is a parsimonious explanation? What sort of explanation is the simplest to account for the most of the most aspects of the problem before us? It seems to me that viral onset is consistent with the craniocervical problem. POTS is consistent with the
Yeah.
craniocervical problem. Immune dysfunction is consistent with the craniocervical problem.
Yeah, it is.
Exhaustion is consistent. You know, you look at a list of ME, you look at the onset, you look at what is making several of us better, and I mean majorly better.
Well, if the ME is causing the collagen gene, that if you've got a faulty collagen gene, for example, to switch on, you may not be presenting as hypermobile, but certainly your ligaments could be going lax without you knowing it.
It could be.
Which why maybe why people find it harder and harder. In terms of when you're like yourself having serious issues in having to be in bed. Yeah, I mean, who knows?
It could be that some people, even if they aren't hypermobile, their ligaments are vulnerable to damage in a way that other people's might not be. I know that Jen Brea would not pass any hypermobility test. She does not have widespread hypermobility. Maddie, the man I interviewed from my website who saw Dr. Gillette and has significantly improved, he is not hypermobile in the slightest. I think that it's become pretty clear that one can have a problem with the ligaments of the craniocervical junction. These specific ligaments can be hypermobile without needing to have generalized hypermobility throughout the body.
I agree.
And the only way we will ever know the answers is if people get evaluated and share.
Yeah, well, that's the point, isn't it? There's you Jen, and after Jen Brea's statement, Dr. Gillette informed me that the number of inquiries has gone up by 400% in 1 week. Right. So that does show, and that is primarily from the ME community. So that does show that people are interested, even if they're not necessarily saying anything on social media. It means that they are questioning it, and out of those that question it, some of them inevitably will then go ahead and have the operation. That means there will be even more evidence to back this patient. What has to be a patient theory for the moment, doesn't it? It can't be anything else. But I've said all along, it's not just about what's written in papers. Patient evidence is also very important when evaluating situations.
Yes, absolutely. Sometimes patients have to lead the way, right?
Yeah. Well, I'm a patient educator at Brighton Medical School because I decided, well, if I couldn't get through to the guys at the top because they're past caring or simply don't want to believe it, then I'd go in at the bottom end and make myself available to talk to medical students. And even actually had a chance in interviewing them as to whether they got a place. I think if a lot of people did that, if we all started, and I know several people locally in the ME community have done that. They've gone down and done exactly the same thing, because I think that's what it takes. If we want to change it, we're not going to change it all the time. We have let's say consultants who aren't willing to listen. They learned what they learned X number of years ago, and changing their minds is hard. So if we could all fight in.
It looks to me like you might be cutting
maybe
out. I'm sorry.
Get the message across. And certainly, if we sorry, Jeff. Hello.
Are you there?
Hello. I am.
There, we disappeared.
Yeah, I disappeared. Yeah. Sorry. What were you?
Oh, I think you were telling me how we essentially just can't rely on the medical profession itself to necessarily
Yes.
adapt new information or to necessarily take this illness seriously. You were talking about a different way
Yeah.
and how
Yeah.
you
Yeah, absolutely. But
oh, the Skype is cutting out again. We are cutting out again. Let's see if there's anything that can be.
bit of time school and providing some information and the truth of the matter.
Oh, Karen, we cut out again. I'm trying to work with the settings here. Yeah, it looks to me that Skype's capability is being stretched here. Can you hear me?
Yeah, I can hear you fine.
I can see you now. I can hear you. I couldn't even see you for a few minutes.
Okay.
Okay.
So, is there anything else you want to ask?
I don't think so. I think we have covered a lot of ground. Is there anything else you would like to share?
No, I just don't want people doing one of two things. Actually, I don't want them rushing to go and have a fusion without doing their a bit of careful.
No
and
neurosurgeon worth their salt would ever do a fusion on a patient who rushes in and says, "Do it. I have ME. I need my head screwed on now." No neurosurgeon worth their salt. They will say to that patient, "You are crazy. Leave my office." Okay, so
they will indeed. They will indeed.
People
But
a neurosurgeon will just go, "Okay, here you are, ME person. Let me drill into your skull right now. You're a vulnerable little patient, aren't you? Let me take advantage." It doesn't work that way. These neurosurgeons are very careful, particularly Dr. Gillette, the one I list.
Oh yeah, Dr. Gillette has my utmost respect. He is absolutely marvelous, and his team. You know, where you have your mast cell specialist, your pain specialist, you know him, and they all work like clockwork together. It's absolutely incredible
And they're
seeing.
used to the chronically ill population. These particular neurosurgeons know how to deal with POTS. They know how to deal with MASL. They have seen certain constellations of chronic illness, and they go slow. They're not going to push you. Did you feel pushed? A lot of people are afraid that Dr. Gillette or Dr. Henderson, whomever, will push them into surgery.
Well, no, I obviously I didn't see Dr. Henderson, so I cannot comment on that.
Yeah.
Dr. Gillette, however, I can tell you he was not like that at all. In fact, he told me exactly what he thought the outcome would be. He then said, "I don't know about XYZ, Karen. I am not God. I am not a magician.
Beautiful.
And I can only do what I can do. You know, and this is what I believe your outcome will be." But I certainly know people he's refused. He's refused on two grounds, actually. He's refused on a couple of occasions, I believe, where he's felt the patient isn't mentally prepared for this type of surgery. Because obviously you do have to consider, you know, your neck is now fused. He has also turned down people either because there was absolutely nothing wrong with their neck, or because there was actually something wrong with their neck, but that it wasn't so bad that it couldn't be improved by those very gentle head exercises I do earlier. And he would suggest that as the first port of call in patients where it was just starting.
That's an important point, that surgery occurs when conservative options of treatment have failed.
Yes.
And surgery occurs when there is objective evidence on scans and in-person testing. Surgery, you cannot have neurosurgery like this. You cannot have a fusion without substantial support.
No.
And
and there are a lot of scans, aren't there? There are a lot of scans taken.
I'm aware of Gillette turning people down, saying, you don't have a severe problem here.
Yeah.
I'm aware of Bolognese, Henderson, Sandu. All these neurosurgeons are so careful. They do not perform surgery on everyone. In fact, the standard for neurosurgery is quite high. And I think that that's a common misconception, probably driven by just fear that somebody will take advantage of your desperation and drill into your skull for money. But I really, really...
Well, I certainly know a British neurosurgeon who shall remain nameless, who implied that.
Yes, it's being implied
particularly
by
about
Dr. Yeah, so...
He said he was in it for the money, but I had to laugh because I was in a private appointment with this particular neurosurgeon. So I did point out that he was being paid for his time too,
Oh, what are we going to do? We're going to do something.
I think the evidence is coming through. I'm also aware that in the UK there is another neurosurgeon. I'd better not say his name, but I know that he is collecting data secretly on what he's seeing on CCI being discussed on social media and what he's seeing in the press. He's collecting all press articles as well, and then they are monitoring the long-term outcomes that way, because they have no means of testing outcomes here because they haven't performed enough surgeries on people with EDS or ME to our knowledge, because I don't really have that information to hand. But I certainly, with EDS patients, that data isn't available, particularly because it's not worth it. No, not yet. And so that's the point. Sometimes I have to stop and remember that in the world of genetics as well, because there may well be a gene switch being switched on at some point in this as well. We have to remember that all things like genetics, that's all come about in very recent years in terms of our history. So there's a lot we're learning.
And even if we don't find a specific gene for the next 10 years, we can still have an idea just based on observation, even if we don't have the specific area in a genetic code, or should
there isn't actually
not findable.
For one of the sorry, I talked over you there, Jeff. For one of the types of Ehlers-Danlos, bearing in mind there are 14 subtypes, for one of them the gene has never been found as yet.
I know. And that's the one that's most likely to need a fusion, is the type, the hypermobility type for which we haven't got a gene. How convenient is that? So yes. And what I've observed is we can't always wait for science to catch up, or the systemic factors to prove something. We can have wonderful amounts of objective data right now. We can have rates of depression. We can have thorough neurological examinations that are very well done, very objective. We can quantify our improvement. We can describe how we were prior to our fusion. We can describe exactly the criteria by which the neurosurgeon decided to operate. We can describe our own mental process of whether we refuse to be operated on for whatever reason, or whether we went ahead with it, and then we can describe what happened afterward. This is the earliest stage of science. It always starts with observation, anecdote, and it goes from there. So I do sense sometimes, not always. I mean, you can go the opposite direction. You can just want to jump right in, which I did. But the others, the extreme caution of waiting for science to have proven this in a clinical trial.
Oh, yeah. Well,
20 years, 30 years. I mean, what.
Yeah, well, that's why I said I don't understand that attitude at all, because I lost 30 years of my life to some extent and to varying degrees. I remember being in bed 6 months. And then I'd be okay for a few months, and then I'd be back in bed for a month, and for 30 years I was living a half life. So had somebody have said to me early on, oh, well, have you considered it might be your neck? And this is why, because of the ligaments and this neural pathway that goes to all your organs. How do you know? You could have, somebody could have easily have done that going for a horse ride and not know it. So it is something that if somebody had said it to me, I think, okay, I don't know whether I would have rushed in, maybe, but I most certainly would have had it done as I felt fit, at some point, definitely. And I certainly wouldn't have waited anywhere near 30 years.
Right. And if you consider the current prognosis for ME, is poor.
Yeah. Well, that's the point I'd got to, Jeff. The point was, well, really, do I have a purpose anymore? All I'm doing is sort of just cluttering up a bedroom and creating more work for the people around me. Is this really a life? And I had got mentally a little bit to that point. I wasn't suicidal, don't get me wrong, but I most certainly did sometimes think to myself, it would be nice to just not wake up. Yeah, and so to have gone from that to this, where I'm able to walk around and in such a short space of time, even Dr. Gillette was astonished, and he then, he said, "Oh, I've got to film you walking, because I've got the film before of you in your wheelchair, because I used to shake like I had Parkinson's a little bit."
Yeah.
And so he said, I want to take, he had the footage of that, and he said, I want to take footage of you walking. And he took it over to the Netherlands, because of course it's the whole of Europe that won't treat, not just the UK. There's 60% of Dr. Gillette's patients actually come from Sweden. So the Sweden and the UK make up the bulk of his patients coming. But yeah, it's one of those, and then the rest are from other parts of the Europe. But it's certainly only Spain or USA. There's nowhere else.
Right now, yeah. I wonder how soon that will change.
Well, certainly, I can tell you in Spain, they're certainly training people up. That I do know. So that would mean that eventually that has a knock-on effect, that somebody else then gets trained up. Mm-hmm. They're not all going to stay in Spain indefinitely. I can guarantee that. And I even know that Dr. Henderson has been over in the UK recently.
Yeah.
So he has been having chats. And we'll see what comes of that, because one of the neurosurgeons that was invited to that was the neurosurgeon that I saw, who was less than polite about the operations in Spain, and actually I found that totally unprofessional. There's no need to be.
Quite often what you are describing, where a neurosurgeon that perhaps is not well versed in craniocervical instability, that does not believe in this, despite there being substantial evidence to support that craniocervical instability exists. I have found that a lot of neurosurgeons will literally badmouth the neurosurgeons that perform these surgeries.
I just don't. It's not professional, though, is it? You wouldn't normally do that. And for people who are meant to be of substance, I think it comes across even worse when they start pulling apart each other's work. I certainly did my research, into where I was going to go, and Dr. Gillette had such spectacular reviews. It was a no-brainer for me, and it happens to be closer, which meant less time in pain on a plane. So and when I went over there, I was astounded actually at how amazingly well run everything is. Yeah, yeah. So, but I would definitely, if you've got ME and you're in a serious way, and you've got to the point where you're thinking, what is the point? Then perhaps you really should get yourself a scan and see if you can just change that around.
Okay. Well, thank you for agreeing to be interviewed. Thank you for sharing your story with the broader world.
No problem.
So glad that you're so much better. It's just wonderful to see. And I saw your husband just so happy in one of the videos of you walking. It was.
I thought he was going to cry.
I did. It was
He,
amazing.
he looked as if he was just about to cry, but I think he was so scared that not that something could go wrong. He wasn't worried about that at all, but he was really, really scared that it might not have any dramatic difference to me. And we'd crowdfunded the money, so you feel a custodian of that money as
Yeah.
well. However, the complete opposite was true. I was up and out that bed as at the first available opportunity, and even though I had 2 ribs removed myself for this fusion, because I was scared. I had Marcel issues,
Yes.
and I was concerned that my body might reject donor bones. So I used my own, so that wasn't a possibility. So 2 of my ribs on my right side were taken. And Dr. Gillette said, you're going to put yourself under an awful lot of pain doing that. But I think sometimes you have to trust your instinct. And actually, apart from the first 2 days where, it was a bit ouch. After that, pain was, more of just an ache. And so I haven't actually got regrets about doing that either. But most people, I think, take donor bone and use that instead, rather than put themselves through extra surgery.
Yes. I think that some of these neurosurgeons leave it up to the patient. Others will not do the rib graft. Every patient, if they're interested in this technical aspect, can call the specific neurosurgeon and ask what their protocol is.
That's correct, because I believe Henderson uses a taping method of some description.
It really depends on the patient. He will use it sometimes in the lower cervical spine, but never in the craniocervical junction. That will never be taped. That is always with general titanium screws and rods.
Okay.
Some form of bone graft, whether taken from the patient or non-autologous. So
okay, so that's exactly the same then as Dr. Gillette in terms of cervical spine. Yeah, absolutely. Yeah. Okay.
Thank you, Karen, for sharing. And
no problem. You're very welcome.
Have a wonderful day. All right.
Thank you.
Thank you.
Bye-bye. Bye.